Hi, I'm Christina Bausch. I'm a physical therapist and pelvic floor specialist here at Rebound Physical Therapy. We are an outpatient clinic and we're located in Topeka, Kansas. Today I'm going to talk to you a little bit about constipation and how physical therapy can actually help to treat constipation. So to begin with, I'm just going to explain the anatomy of the pelvis a little bit, which will help to explain how it all relates. So if you were to look at the pelvis, so if you look at it from the front, you've got the pubic bone in the front. In the back, you've got the tailbone coming down in the back. And then if you look down on the bottom of the pelvis, you've got all this pink area. And what that is that's actually a bowl of muscles that is called your pelvic floor muscles. So what we want for those muscles is that when you're just at rest, those muscles should be fairly relaxed. So if you were to imagine like my arm muscle, where it's just hanging there, when it's relaxed, there's a little bit of muscle activity going on, but not very much. When you go to move around, we want that muscle to be able to engage and work. It's going to contract, provide support, but then once it's done, you should go back to that relaxed state. Now, when you want to either empty your bladder or have a bowel movement, we want that muscle to actually be able to go from that relaxed state to actually shut off even more. So we want it to be able to relax, lengthen down, and that's going to help to straighten that bowel angle and help you to be able to empty your bowels easily. So for some people, there may be a couple different things going on. So for some people, maybe that muscle is not relaxed at rest. So for some people, they may be holding a little bit of tension in that muscle all the time. And so it's not really able to relax well enough to allow a bowel movement to occur. And then also for some people, maybe that muscle is okay at rest, but then when they want to empty their bowels, there's some discoordination going on. And instead of that muscle actually relaxing, maybe it's actually tightening and helping to kind of close off and preventing that bowel movement from passing through. So one thing that we can work on in physical therapy is to help to retrain those muscles to do the right thing at the right time. So we can help to reset that resting level and then help to teach you how to coordinate that muscle to be able to relax and to be able to empty your bowels without that muscle kicking in and biting you. One of the tools that we use for that is called Biofeedback. So it's actually a computer system that we can use where we use little electrodes that are going to monitor what those muscles are doing, and it shows you on a computer screen so that you can see in real time, okay, are my muscles tensed? Are they relaxed? Because on those internal muscles, sometimes it's really hard for you to just know what's happening. We can work on other strategies too. Sometimes there's some restrictions in the fascia throughout the abdominal cavity where all of your colon and intestines are that's slowing things down. So we can work on anything there that maybe contribute to your symptoms too. So for some people, they may be experiencing pain or difficulty with the bowel movement. Some people may have incomplete emptying. Maybe it seems like they need to go several times before they're able to empty. For some people, they may not realize that really they're having an issue with constipation, but they have a lot of abdominal pain, and it may be that they're going a little bit at a time, but it's really just not emptying completely enough. So depending on what the scenario is, we can work on all of the factors that are contributing to it to get to the root of it and help resolve your symptoms. So if you're having any of these symptoms, or if you wonder if maybe your pelvic floor could be playing into it, just reach out and contact me. We can do a consultation and discuss your symptoms and see if that's something that physical therapy would help with.